we're in Hall J at the Convention Center. We're at a special needs shelter that has been set up to do two things. One, make it possible for people who are special needs patients not to evacuate. Some of these folks were heading to other parts of the state, either Alexandria or Shreveport. Because they opened it, we were able to secure this location here. Also for individuals that we got back really quickly. And so what you have here really is a really wonderful example, again, of the work that President Obama and Secretary Sebelius did with the Public Health Service and with the DMAT teams. You see a lot of federal agencies in here in partnership with the state. Dr. Jimmy's here, and he's going to talk in a minute, in partnership with Dr. Karen DeSalvo. We have 73 citizens in here. We actually have a lady named Miss Emily who's 103 years old. I had a chance to walk around and meet with each of them. They're all comfortable. They want to get home. No question, I got an earful about that. But the care has really just been miraculous, and so I wanted to come and thank them for all the work that they've done and just touch the folks that were here and let them know that we're doing everything we can to get them home as quickly as possible.
This has been open how many days?
Since Thursday evening.
Since Thursday evening.
Okay.
Yeah.
And so I understand this is a case of a lot of these folks, they can't go back home until they have power.
A lot of folks you'll see in here have oxygen tubes. They are somewhat dependent on heavy medication, or they have some electrical problems. So they set up these units. You can see it's very comfortable, it's very spacious. They have a lot of healthcare professionals that have come from all over the place. So I want to thank all of our federal partners. You have folks from the National Guard, folks from the ATF, and then you have every health service on the federal level that's involved, the state as well, and the city. So it's another great example of people working together. It's been really good for this particular storm. Some of these folks that are in here have gone back all the way through storms as far back as Betsy. And I was kind of thinking through a lot of those things with them, and many of them are in good spirits, and they're doing fine. But these guys are giving them first-class help, and I wanted to come back and thank them for doing that. So what I'd like to do is turn it over to Dr. DeSalvo. She'll turn it over to Dr. Jimmy Guidry, and then to our federal partners.
Thanks. I want to reiterate what the mayor said. This is a great example of a successful partnership at the local, state, and federal level, and we've also had assistance from some volunteers. We've had 118 people come through here getting help and been able to send those home when they get power restored. In addition to having the medical care that they need, we're also able to support them with some mental health services and social services and the pharmacy support they need. It's really wonderful that they can be here at home, and the folks that we sent away to Baton Rouge, we've been able to already bring home, so that as soon as their homes are ready and their families can help them out, they're going to get to go back into their own beds, which really matters for them in the long term.
Good. Thank you. State of Louisiana Office of Public Health.
Make sure it's framed up right. Is it good? Okay.
I'm Jimmy Guidry. I'm State Health Officer for Louisiana. In this event where people were getting out of harm's way, many families took care of their own. And really what we're doing today is bringing everybody together to take care of those who have no one to care for them, or they're in trouble because they have some medical condition that can't be cared for when you use electrical power. So by getting all our partners in, working together to help them, we're back closer to home, getting closer to getting home, but some aren't able to do so. But certainly by having these teams of medical professionals provide care here allows the hospitals to do their work so that we keep people out of the emergency room. So it helps everyone in the community.
How long are you guys prepared to keep this open as long as need be?
Our plan is to try to get people home and then work with getting in placement if they can't go home, their home's not going to be available. It's not to keep them in a shelter, because we really don't want to keep people in a shelter very long. So the idea would be to get people home, and if you can't, get them placed somewhere where they can live until their home is ready to be lived in.
Very good. Great. So the next gentleman that's going to talk to you is going to represent the federal government on the Department of Health and Human Services. We have a DMAT team here, the Federal Health Service team is ready, and Skip Lightner, who reports up through the Surgeon General at the Catholic Civilians, is here to talk.
Right here. Great.
Frame him up with the federal guys behind.
That's right, yeah. All the eye candy behind me. Good morning.
Good morning.
I'm Captain Skip Lightner, a regional emergency coordinator with the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health, Assistant Secretary for Preparedness and Response, ASPR for short. My role here is the Federal Public Health Medical Officer. I would like to also quickly introduce several of my colleagues, Commander Amy Taylor, who's my deputy lead, David Kirshner, who's the liaison, and also the team commanders for Virginia 1, that's Tom Swallenberger, and also the team commander for the Public Health Service, Captain Dave Ellison. ASPR, the Office of Assistant Secretary for Preparedness and Response, brings together the public health and medical services available through the federal government to support communities impacted by disaster. Every disaster can affect health. That's why throughout the year we coordinate closely with the states, including Louisiana, to plan emergencies so that we plan for emergencies so that we all better prepared to respond. There is an array of federal HHS resources that we can provide to assist communities in responding to health impacts of disaster, including the National Disaster Medical System, that's NDMS. They have a network of hospitals to receive patients from a disaster area. And then there's also more than 7,000 healthcare and other professional workers from NDMS who come from across the country, leaving their own jobs for a few weeks to provide care for people during an emergency, like the people being cared for here today. There's also more than 7,000 public health and medical folks who are also, We also have Commissioned Corps officers from the Public Health Service. 67 of them are here today in the medical shelter. So we have more than 200 professionals today in Louisiana providing support for the public health and medical response. That includes the staff that you see here who are providing the primary medical support to care for the patients at this federal medical station. On behalf of the entire staff here and across the country, let me say that we are honored to have the opportunity to serve the people of this community and the nation. We are prepared to stay here as long as you need us.